everyone. Excuse me, to another episode here at Jaws Podiatry. We're here in our office-based surgical suite, and we have a very pleasant patient who has been battling severe heel pain during the course of the last several months. Unfortunately, the patient states that the pain has been affecting her daily life activities. Has tried some conservative treatments, none of which have rendered her any type of improvement. When we look at the protocol, once the patient has tried, whether it's be, ice, night splint therapy, over-the-counter orthotics, changing shoes, any type of conservative treatment, and they see that it's not working, some of the patients will usually come in here and say, Dr. Wagner, I don't care what it is, do what you need to do to get my heel better. And that's exactly, in this particular case, this is exactly what we did and what we're doing. So I sat down with the patient, we spoke in great length about the different types of treatments available. I spoke to her about the, what I like to call the trifecta, which is the minimally invasive plantar fasciotomy in conjunction with the microtenotomy, the percutaneous microtenotomy, also known as the dry needling, and last but not least, the PRP, the platelet-rich plasma therapy. We did talk about briefly about ozone, but we're going to first try this, and we have a very, very good success rate using the trifecta and not the quadfecta. So, I'm going to have you guys come around here. So, again, si sientes algo, me lo dices, por favor, okay? So, basically what we do... Okay, so... ¿Dolor?
No.
No? Okay.
No.
So we make a little stab here, just like that. Make a little port like that. You already feel the ligament there. So we almost lost our nucleus right there. We want that. So I already feel it here. So I like to make a little... So now we're under. Let me see if you guys can get it better. There is no tourniquet, okay? For anyone that's wondering, why is there blood? Because there's no tourniquet. And the tourniquet provides hemostasis. So I'm pulling. It's all about tactile, right? ¿Está bien?
Sí.
Excelente. If anyone is wondering, what I'm trying to do is really isolate that medial band. Just kind of creating a pocket underneath and over. Está haciendo muy bien. And there it is. You can actually hear it Maybe, maybe not. Can you hear it, Patty?
Yeah.
I wish our viewers would be able to hear that. So now what we do, I take my little blade again. We're going to change now to a different blade, and I'll show you guys why. This is a very special blade. So it has a dull we snipped it there a little bit. There we go again. There we go. What we basically do again is take our little knife here, our nucleus knife. This is not a knife, it's just, they just call it that. And I still feel a little fiber right here. Well, just a little bit. Again, the nice thing is it's got a dull, I'm just feeling, I'm not cutting. And everything feels clean there. Super. So that's the first part of the procedure. Now we're going to go to the second part of the procedure, which is the microtenomy. Okay, I've already demarcated. I've already demarcated the areas, right? So, you know, you guys have seen me do this before. I can't stress to the public how effective this procedure is. We heal people. That's our business. We heal people. I'm not in the business of band-aids. I've said that before. I'm in the business of healing people. I love to see people come in, but then I also like to see them leave healed, pain-free. Give it another one right here. And if anyone is wondering, again, Dr. Wagner, why are you doing that? What we're essentially doing is we're creating trauma at a microcellular level on purpose. We want the brain to believe there's a new injury. So that way, the brain will essentially throw this entire bucket, so to speak, a waterfall of blood to the affected area, right? Blood, aside from us doing the third part, which I'm still waiting for the PRP, the third part of the procedure, the PRP, the blood itself, right? The blood itself will also provide some of those quote unquote growth factors, nutrients, proteins, etc. Okay? ¿Está bien? You okay? Excellent. Okay, we're done here. Okay, Patty, can you please verify to see where the liquid gold is? Okay. We're gonna put a quick pause and then I'll edit the second part here, okay? And action. Okay. We have our PRP, our platelet-rich plasma, which we have isolated from about 30 to 40 cc's of whole blood. We centrifuged the blood, and now we have isolated the PRP. So now, without further ado, we're gonna go ahead. Te voy a mover el piececito un poquito para aquí. ¿Está bien? ¿Está cómoda? Okay, good. Va a sentir posiblemente un poquito de presión. Si siente presión, me tiene que dejar saber. Okay, so we'll come in through here. If people are wondering why blood, because we have blood inside our bodies. Just kidding. I really want to leave a little bit. Drop a little bit where we did the procedure there. Stop there. And down here, we'll drop a little bit here. We have completed the procedure. The trifecta. Procedure number 1. As everyone can see, I already put a little stitch, even though, you know, it wasn't really necessary. We could have gotten away with a little steri strip, but anyways. Procedure number 1, percutaneous plantar fasciotomy. Procedure number 2, percutaneous microtenotomy. The dry needle fenestration. And procedure number 3, the implementation and infiltration of the platelet-rich plasma. This patient will be strict non-weight bearing for the first week using a knee rolling walker, and then we'll have her start weight bearing second week. She'll be able to work without a problem. We already spoke about everything. This patient did extremely well. Maybe 15 minutes if it's not about, you know, how quickly, but just to give an idea to the public the time it takes to just perform the procedure itself. I'm not gonna say it's a lunchtime type procedure, but it's the preparation takes longer than anything else. So like always, I know there's a lot of people out there, and I just put out a post recently about heel pain. Heel pain can cause a significant amount of misery, unhappiness in patients' lives. You know, excuse me. it's the hamster wheel. Once you get on that hamster wheel, it just never ends, right? You can't get off. The heel pain is like this or like this. In my short career, my approach has been a very aggressive approach in chronic cases. The orthotics will not work. Physical therapy won't work. Cortisone injections, how many can you, after the patient has come in, if I'm not mistaken, ¿cuántas inyecciones de cortisona le dieron? 3 cortisone injections. So, the patient is essentially, running on a treadmill, in the same spot, going nowhere. So that's why I recommend a very aggressive approach. Something's got to give, and we don't want to see a partial tear of that ligament or micro tears of that ligament, because the treatment for that could be lengthier as well, and it can have some long-term, complications and ramifications. So like always, www.jawspodiatry.com, Instagram, Dr. Tojam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Like always, thank you for watching. Have a nice day.